right, 6 minutes after 11 o'clock. Thank you for tuning in. Dr. Riadh Fakhoury is in the studio, and he's here to answer your questions about your health. I mean, every part of your body, he can help answer those questions. And if he doesn't know the answer, he works with other doctors that do. This is the Head to Toe Care Show, and Dr. Riadh Fakhoury is the chiropractic orthopedist and owner of Fakhoury Medical and Chiropractic Center right here in Ocala at 1009 Southwest 16th Lane. And the phone number over there is 352-351-3413. And over there is right near what I call Governor's Bridge. It's the bridge named after two governors on 17th Street. Relatively new bridge. If you're familiar with the area for a while. And right now, if you'd like to call Dr. Fakhoury, it is a live show on October 10th. So if it's October 10th in your world, then you're listening to a live broadcast. And the phone number here is WOCA, is the WOCA Climate Control Source Hotline, 622-WOCA. Good morning, Doctor.
Good morning, Larry. How are you?
Lots and lots of stuff to say in the intro.
Just a lot of information.
Yeah. How's everything?
Everything's great, thank you.
Everything's
wonderful.
One of the biggest things, I think I'm experiencing this right now with my mother, is reluctance, apprehension, and I think that's all boils down to one word: fear, or discomfort or something. Does that happen a lot?
It does.
Yeah?
It does. You know, the unknown makes people feel uncomfortable, and since they're not aware of what may happen at the Fakhoury Medical and Chiropractic Center with the results with their care, and they're in pain too, so they feel vulnerable. So what we do is help to alleviate those fears by spending time and by having a wonderful support staff that's very caring and very loving. Immediately that person will feel comfortable. But really information, like for example, I had a patient that was apprehensive this morning, and we talked about how gentle the treatment can be with use of the activator, which is a very gentle tool that will still help us with the alignment of the spine, take the pressure off the nerve, get them feeling better, more motion, but it's extremely gentle, and we could talk a little bit more about that.
And I just know this from knowing you. You are very skilled with your people skills. Can I ask you just to turn that microphone a little bit? You're talking into the side of it. Yes, that would help.
Testing.
Oh, much better, much better.
Okay.
I mean, I could hear you, but it was kind of like distant. All right, good morning. Thank you for being patient with us. You're on the air with Dr. Fakhoury.
Yes, good morning, Dr. Fakhoury.
Good morning, sir.
I guess we have to address the hot topic right now in this area, that is how safe are steroid injections, and
Yes.
With meningitis, and have they been discontinued until things have been settled down, or what's going on in that subject?
Okay, thank you very much for that question, because there is a lot of concern around that, and it's very important because fungal meningitis is very difficult to treat, especially when it's a fungus, and a fungus is more, bacteria is easier to treat, but when you have a fungal infection, it's slower to heal and to recover.
Yeah.
And what is meningitis? Let's talk about that a little bit. You have your spinal cord, you have your brain, and there are linings around that that wrap that spinal cord, and those are called meninges, and they're like wraps around the spinal cord. And so itis is inflammation, and meningitis is inflammation of the wrapping around the spinal cord. It is very, very painful. And you know you have meningitis by the fact the symptoms are that you cannot tuck your chin down. If you try to put your head down, you will feel severe pain to a point where you're extremely rigid. You have lack of motion in your neck. You also have usually some type of low-grade fever that's going on too. But the fact that you can't turn your head, you can't move your head, you can't flex your head, and these cases of fungal meningitis have occurred recently from a specific laboratory that has put out a bad batch of corticosteroid mixture, which is what the interventionalists will insert in and around the spinal area, the spinal nerves, to help bring the inflammation down and bring the pain down. Relatively speaking, if you think about all these years that interventional medicine and epidurals and facet blocks have been done, we haven't really had an incident like this. So overall, they have not had incidents, but now because of this bad batch, there's a lot of fear in that. And so what that laboratory has done is recalled all of their products, and they've gone to the different facilities where, and some of them in Marion County also, where this tainted corticosteroid has been used, but now it's recalled and pulled back. At the Fakhoury Medical and Chiropractic Center, we do interventional medicine. We have a C-arm, which is a fluoroscopy unit or a motion X-ray unit for our interventionalist, Dr. Hobbs, who's double board certified. we always are very keen on making sure we use the top FDA-approved laboratory that maintains the highest standards, so that way we're not dealing with products that might have been sitting on the shelf too long or that are tainted. So we are not one of those offices that has those products. So we're uninterrupted in our treatment for those patients that need interventional medicine. And we're cleared to continue with that. So that procedure continues in our office as we're using from a completely different source, unrelated to this laboratory, which I think is out of Massachusetts. And we are always, in all our products, we strive to get the highest caliber product available for the patient.
So in other words, a patient going to your service would not have to be too concerned about the steroid program as it is right now.
Exactly, that's correct. And the treatments continue, and we're cleared to continue, and we're using we've ordered from our products from a complete different laboratory than this one, so we haven't had any problems or interruptions from that.
If a person does come down with meningitis, if it's caught in a real early stage, are your chances pretty good of surviving?
Yes. You see how many cases there are, and God bless, and unfortunately there are fatalities, but to the number of cases that there are in the month that's been done, thank God the cases are limited and smaller in number. I mean, just one person having a problem is terrible, but relatively speaking, it could be a lot worse. So the beauty of our communication system these days is the word spreads out very rapidly, so the problem doesn't continue and grow bigger than it should. As soon as there was this knowledge, there was immediate evaluation. Everybody called in, reported what their lot numbers are, who their suppliers are, and it was put to a quick stop. So those with tainted lots were recalled and returned back immediately for investigation.
Steroid use is pretty popular for back and neck pain, right?
It is, but you don't want to use it freely. So at the Fakhoury Medical and Chiropractic Center, we use a flow chart, so to say, or a series of steps to try to take care of that person's pain, whether it's back pain, neck pain, leg or arm pain, in the easiest and most conservative manner possible. So our first line of defense is the massage, rehab, chiropractic, which we call physical medicine. We can help to alleviate maybe 70, 80, 85% of those cases and get them under control very rapidly with those. Then you have the cases that are not responding as well as we like. Then we can bring in the light anti-inflammatories, muscle relaxants through Dr. Shanawani, our medical doctor, to help bring the inflammation down. And if that's successful, that gets another percentage and allows us for a very high percentage of success in the clinic, conservative medical and chiropractic. If that doesn't work, then we will usually use some diagnostic study to see if there's something more that might be going on in that region. Could there be a disc herniation or something else that is important for us to know as clinicians in the treatment of that individual. And let's say they're not responding, they do have a disc herniation, and their signs show us that there's pressure on the nerve, which could be dangerous. Then what we do at that point is refer to Dr. Hobbs, our interventionalist, and he will evaluate if the patient is a good candidate for the interventional medicine and decide whether an epidural or a facet block is going to be the best for the patient. Because if we don't stabilize that patient under one roof in our office, then they may go to surgery, and we could have maybe saved a percentage of those people from surgery by the interventional medicine and reducing the inflammation, taking pressure off the nerve.
Okay, well, let's hope this whole thing gets straightened out sooner or later. It's a bad thing, and it sure put Florida in the limelight, especially Marion County here. We had quite a lot of news on the network, so
that's right.
Let's hope it gets straightened out. Well, thank you very much for your information.
Thank you for your question and your concern.
Bye now.
And you have another phone call. Good morning. You're on the air with Dr. Fakhoury.
Good morning.
Good morning.
I just wanted to find out, I know the top number one biggest fear going to the medical perspective with the schooling is the blood. And I just want to find out, when you go into the medical field, can you explain how far and also how long you you have to be in the medical field?
Okay. All right. So if I understand your question, basically, what is the training or education for a chiropractic physician to go into practice?
Yeah.
Okay. Very good. Okay. Thank you for that question. And when we prior to going into the chiropractic university, you need to have an undergraduate degree, which is usually a bachelor's of biology or physiology or applied physiology. It could be almost like a pre-med program. It's in line with a pre-med program. You have to take the certain biology courses, English courses, chemistry courses, and anatomy courses. So you get that bachelor's of science degree. Then you apply for the chiropractic college. The chiropractic university, their curriculum is very aggressive because not only do you need to understand the medical component, but you also need to understand the chiropractic component. So if you look at the medical doctor's curriculum, we're the same curriculum with anatomy, physiology, psychology, physiology. We have all those same courses. Pharmacology also, as they do, which is the understanding of medications, but not to the same degree as they do with pharmacology. Now, where they concentrate on surgical procedures, we don't do that. Instead, we start concentrating on chiropractic procedures, which is the mobilization or movement of the joints of the body to help with the recovery of the pain. And so, if you look at the actual core classes of anatomy, physiology, and such, we're very parallel. Now, when it comes to radiology and x-rays, we take additional classes in radiology and x-rays than the medical doctors because we are working directly at looking at x-rays to figure out and since we concentrate on mobilization of the spine, we need a vast knowledge on being able to do that. And then after you pass the university, the chiropractic university, then there's usually three examinations that need to be passed. And then after that, then you can start practicing as a chiropractic physician. So when I was at Los Angeles College of Chiropractic, I was dual enrolled in a doctor of chiropractic degree as well as an additional bachelor's degree. So my time in the classroom, actual time, was between 38 to 40 hours a week. So it was like a full-time job getting the knowledge and information. Then graduated chiropractic physician and then continued on with a 5-year program to become board certified in chiropractic orthopedics, which was another extensive program. And after that, then another national examination to be able to be certified in that program.
All right, and that's we started out talking about having an amount of comfort when you walk into an office,
Yes,
and
sir.
that's got to be one of the first things people want to know. You know, what is the background of the person who's going to be looking at me, you know?
Background and also how much experience, and because the more experience you have, the more of different cases and unique cases that you see, and your comfort level goes up, and your experience, because they call it practice for a reason. So the more you see, the more you understand, and the more you can help people. And as you said, the more knowledge base there is, the more we can help. And that's why at the Fakhoury Medical and Chiropractic Center, it's not just one physician. We have 4 chiropractic physicians. We have 3 medical doctors. And and everybody has their background, their experience, so we can all pull under one and put our mastermind, our knowledge together to be able to help that individual.
And I guess the other fear that people have is finding out their worst fears, like, oh my goodness, I'm having a heart attack, I have cancer, or something like that. They're waiting for you to tell them they don't, but at the same time, that's their fear that you will.
Yes, it's difficult. It's rare, but when we do have something news like that, for example, Dr. Shanawani was ordering a routine chest X-ray and found that this person did have a cancer of the lungs, and caught that, and immediately sat down with the patient. From his years of experience, remember, he's been in the medical field for 25 years, seeing everything, because he was an emergency room, urgent care medical doctor. So he's seen everything from splinters to having to do surgery on people's hands. And with that, he can sit down with them, counsel them, talk to them, and get them to the right person immediately. So that way they can start the care, because fear keeps us from acting, and that sometimes is dangerous, because the longer you wait, even if it's a simple problem, it becomes bigger as time goes on.
So it's kind of like a big lump early in the trip. You're going on a long trip, and there's a big hill you got to go over first, and then the rest is smooth sailing. In other words, I go to you, and I got this pain in my shoulder. and I'm worried that it's a cancer tumor because it's got a lump on it. You look at it, you tell me, here's the problem, and the word cancer never comes up, but we have to take 6 to 10 weeks to work on it. I don't care. At that point, I'm over that hump. That
Right.
6 to 10 weeks is downhill for me, you know?
And you're right, and that's where knowledge and communication comes in, and the patient is more relaxed. In fact, an example, there was a patient coming in today that was talking about, he's young, he's maybe 25 years old, his entire arm goes numb, all fingers go numb, and his shoulder hurts him. He sleeps in the morning, his hand's numb, he holds the stick shift on his car, on the car, his hand goes numb.
Oh, no.
And he's had this for 2 years since he's hurt his shoulder going forward in a roll in a boot camp exercise.
Oh, uh-huh.
So the fear of the unknown has kept him from coming in. So we sat, we talked, we palpated. In 2 minutes I told him, your shoulder is out of alignment, you've hurt the brachioplexus nerve, your muscles are tight, your neck is involved. And he said, you know, just knowing that this is the problem and you can take care of it, you could see the relief in his face.
I bet.
And he's coming in tomorrow because 25 years old and the numbness, and it's not going away. It's been a couple years. Now the communication makes people feel more comfortable. And at the Fakhoury Medical and Chiropractic Center, we communicate, we talk. And that's very important because patients come asking questions and they want information. And once you know if it's a problem, you know how to address it. And if it's nothing to worry about, then your mind is at ease.
And again, that 3-day rule of thumb that you always talk about as far as pain. If you have a pain or discomfort for 3 days and it's not gone, don't wait any longer. That's the moment of truth.
And here's a good example. A very close friend, her son-in-law hurt his shoulder. Somebody stumbled and he went to catch them, and they both fell, and he landed on his shoulder.
Right.
And it swelled up and he couldn't move it. Happened Sunday. Monday, Tuesday wasn't getting better in the office. Yesterday, Tuesday, and we started evaluating it, treating it, and he may have a torn rotator cuff. We're going to give it 2 or 3 visits. By the end of this week, we'll know how he's doing. If he's better, great. If he's not, we'll move forward, get the MRI done, and move him to the orthopedic surgeon if it's torn. And that's how we operate, as we move very swiftly because people are in pain. They don't want to stay in pain. You need to have a good action plan and progress on how to take care of that individual.
You just used a phrase you've used before, and I think I know what you're saying, but could I get you to spell it and kind of explain what it is? Rotator cuff.
Exactly.
Is it 2 words?
It's 2 words, and some people, instead of cuff, C-U-F-F, they call it cup, C-U-P.
Okay.
So it's a cuff, C-U-F, because it encircles the shoulder joint.
1 F?
2 F's.
2 F's, okay.
It encircles the shoulder joint. So it's rotator as R-O-T-A, of course, T-O-R, and what it does, it allows the motion of the shoulder and the ability to be able to lift the shoulder away from your body 90 degrees and 180 degrees. So when the rotator cuff, which is comprised of 4 different muscles that wrap around the shoulder, the supraspinatus, the infraspinatus, the teres minor, and what happens is in the subscapularis, when one or more of those are damaged or inflamed or torn, then you start losing proper function of the shoulder, and then the shoulder starts to work improperly, and then the head or the ball starts jamming into the cup, and that starts causing arthritic changes and more problems. So what we have the orthopedic tests, we have the equipment to be able to evaluate that, treat it, and if it responds, which most cases it does with our physical medicine, that's great. If not, and we do an MRI and it's a torn rotator cuff where one of the main tendons, the supraspinatus, is torn all the way through, then we refer to the orthopod, and he does the surgery, or she does the surgery to mesh that together.
Now, somebody who has that problem, can they? This is off the wall question, but can they hear it? I mean, can they hear that separating from it?
No, they won't. They won't hear it. But sometimes what they will notice, if it's very unstable and there's other components of the shoulders that have been torn, they will sometimes hear a clunking or clicking noise, which is not good because that's the ball and the socket.
Oh, so they can hear something.
Yeah, bumping together.
Okay.
And that sometimes happens in the knee and the hip joint also, which tells us there's a lot of damage to the joint because it's unstable. And those 2 bones are moving too much and hitting each other, and that causes a lot of damage because the protective lining around those bones, the Teflon coating or the hyaline cartilage, is being worn off, and then that will produce a lot of arthritic changes.
Yeah, the reason I was asking about hearing it is because somebody, well, I don't know the person, but I was reading about them. They're musicians, and they were in the recording studio, and there was something going on with their shoulder, and it was being picked up on the microphone. So I was thinking, wow, I wonder if that's the same thing you talk about.
It certainly can be. And then there's other times also that, we were talking about being afraid and not coming in because of that. Well, sometimes when people come in, they realize it's just very simple, like it could be a tendinitis or inflammation of a tendon, which is lifting that tendon up because it's swollen, and it pops out of its groove a little bit, so it clunks in and out of the groove, and all we need to do is some massage, some laser, some ultrasound, reduce the inflammation around that tendon so it settles back into the groove. And when it settles in the groove, it's back in place. It won't keep popping in and out. So people sometimes are deathly afraid of coming in when the solution can be very simple. And for example, as I was saying, there was somebody this morning. She has a neck problem. She has headaches and neck pain, shoulder pain, but she said, I'm afraid to come in. And I explained to her that there's no reason to be afraid. You come in, the staff is supportive. The doctor, one or two of the doctors, will do an examination. We'll explain to you what the problem is. The treatment is very gentle. In scenarios, there's all different types of chiropractic manipulations. Some of them are with the activator, which we would use on this patient, or a little clicker, so to say, where it helps gently push the bone back into place, so she'll barely feel anything, but the results will come.
And if you are out there right now and you have a question for Dr. Fakhoury, feel free to call. The number is 622-WOCA. That's the WOCA Climate Control Source Hotline, 622-9622. Speaking of fears, money is always going to be a fear. I don't want to go to the doctor because I'm afraid it's going to cost a fortune.
Yes.
Address those fears.
Well, we don't like anybody to leave because of finances. It's very important. They're coming in, they're having a problem, we want to take care of them. So if they have insurance, we pre-authorize insurance ahead of time. We never like the patient to be surprised, so we will sit down with the patient prior to anything being done and saying, this is your problem, this is what the doctor needs to do, and this is what your insurance will cover or will not cover. And this day and age, some people need some help, and we're there to help them out. So whatever needs to be done to get them taken care of, we do it.
Well, and in that regard, that's exactly what happened when I used Fakhoury chiropractic services, and I was thinking the same thing. How am I going to pay for this all? But I was assured by your staff and your brother's staff and that you're covered, don't worry, and we'll take care of you until you don't need us anymore. So
yeah, and people are pleasantly surprised because when they come to the Fakhoury Medical and Chiropractic Center, if they have insurance, if they don't have insurance, we see a multitude of patients that are private pay patients. That means they pay for the care themselves, and we make it very affordable, and we get them taken care of. And they're surprised when they come in. They're pleasantly surprised that our service is geared towards taking care of them with sincerity and making sure that we are staying within a level where they can receive the care and be able to follow the treatment through and get taken care of, and not just see them only once, but really be available for them as their musculoskeletal care center. So in the future, when they have problems, they'll refer their family or themselves over. About 95% of our patients walking into the clinic are referral based, friends or family referring them over, and that means a lot to us. It's very important because that's the highest compliment that we get when somebody refers somebody else, and it means that that we are always trying to. We're there to service the patient, take care of the patient.
Well, those of you in the medical field are a gift from God to the rest of us. I just hope we're giving to you as much as you're giving to us. I mean, it sometimes seems imbalanced.
Not at all.
I mean, what do I give you? A radio show? You know, it's nothing.
When I see a smile, that's great. Well,
tomorrow we're taking a field trip to see you, too.
I'm excited about having you and Robin over. It's going to be wonderful.
Yeah.
And also, another thing is what comes in, what helps us and what gives us that inspiration as, the medical and chiropractic physicians and the staff at the Fakhoury Medical and Chiropractic Centers. When somebody comes in one day and the next day they come in and they look like a different person.
Feel better, yeah.
They look better, they feel better, they're smiling, it's just like a night and day.
Yeah.
That is such a refreshing feeling.
Well, you are a refreshing host, a refreshing doctor, obviously, and have become a good friend of all of ours here. The phone number, how do we get a hold of you?
Well, the office number is 351-3413, And option 4 will take you to the front desk or our patient care coordinator, Amy, and we will get you scheduled the same day, the next day. If you have insurance, we'll pre-verify that ahead of time, and if you have access to a fax or email, send the paperwork to make it more convenient for you. And but the number is 351-3413, option 4, and one of the staff will be available to answer any questions that you have.
And tomorrow, as we mentioned, Robin and I will go visit you. We're taking a field trip. You're giving us a little tour, right?
Yes.
And we're going to, and this is my opportunity to give your address, we're going to your location on Southwest 16th Lane, which is just a block away from 17th Avenue, right?
17th Street, right off of 17th Street.
1009 Southwest 16th Lane, right on the other side of the new bridge, which is called, it's got the name of two governors. We call it Governor's Bridge.
Right. So as you're coming down the bridge, you'll see a light in front of you. We're to the right-hand side. If you just make a right at that light, immediate right, and it'll bring you parallel to 17th and right back to us.
Yeah. Dr. Fakhoury, thank you so much for all you do.
Thank you, Larry.
We will take a little break and be right back.
Hello, this is Dr. Riadh Fakhoury, chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Listen in to the Head to Toe Care Show every Wednesday, 11 a.m. right here on WOCA. Learn how your body works so that you can help yourself. We're available to answer your questions every Wednesday at